Welcome everyone to another wonderful episode here at Podiatry. Today, we're going to be performing a platelet-rich plasma injection. A second one to the same patient. This patient, we uploaded a video. This patient sustained, we'll say, an injury. We were actually just talking about it, that even though people think it's not very common, it is. I don't have my whiteboard, so I'll just kind of give everyone a Cliff Note version. At the level of our joints in our feet, okay, the metatarsal phalangeal joint, we have a plate underneath. Okay, so let's make believe this is the plate, right? The plate, and this is the metatarsal head. The metatarsal head glides, okay? It glides when we walk. And this patient suffered a partial tear of this plate, okay? And it's an extremely debilitating and painful injury. A lot of surgeons, clinicians, physicians, surgeons, the first thing they would do is recommend surgery. I know for a fact. The surgery is no walk in the park. And even with surgeries, no guarantees written or implied. Again, you have a plantar plate. The metatarsal head glides, okay? The patient has a partial tear of this plate. So a couple of weeks ago, we decided to inject the plantar plate, the joint, with PRP and immobilize the area. The patient today, after several weeks, is now feeling
70 to 90, depending on the day.
Depending on the day, 70 to 90% better. So, a lot of people ask me, and this is where I'm going with this video. At this point, we kind of discussed some other possible options. I said, you know what? This may be a good opportunity to give, to perform a second PRP, platelet-rich plasma injection. Now, to refresh everyone's memory, PRP, platelet-rich plasma, is a regenerative type of procedure that we perform here for many conditions. We draw blood, we spin blood. Blood separates into good and bad. The bad we throw away, the good we keep. The good has the growth factors. It contains the anti-inflammatory cells and the cells that aid in anti-inflammation. I want to be very clear. PRP is not stem cell therapy. PRP is not amniotherapy. PRP is not umbilical cord therapy. Very important, because, and I speak the truth, there are a lot of physicians and a lot of clinics these days that are advertising incorrectly anything that falls under the umbrella of regenerative medicine. Do your homework, ladies and gentlemen. So, just like in this particular case, there are cases, heel pain, plantar fasciitis, Achilles tendonitis, any type of tendonitis, or any injury, fracture, whatever it is. The million-dollar question, Dr. Wagner, do I need a second injection? And I would say 85% of the patients don't. So we do one, a really good one. Good one, I mean a lot of blood. We concentrate a lot of blood to be able to isolate, a very high concentration of that platelet-rich plasma. I'm not going to talk more. Let's get to work. Okay.
Yeah.
So we, believe it or not, from a lot of blood, very little plasma, this is, this particular joint is very small and it already has fluid, inside of it. So it's sort of like a balloon, right? It's already filled with water, for example, a water balloon. And we don't want to, the water balloon to fill too much, right? So I know the joint will tell me if it's low on the synovial fluid or space or not. It will tell me. Okay. So again, put a little bit of anesthesia. The thing that I tell patients with these types of injections, this is intracapsular. So the numbing, the local anesthesia may or may not work. And if it works, is it gonna work 100%? So I'm gonna tell the patient now, we're gonna go ahead.
Now you tell me.
We're gonna go ahead and proceed now with the injection. Okay. Okay. So basically, it's a tiny little needle. Check this out. These are wonders of needle. This is great. And I know exactly right here. That's the joint. It's my time to shine. In the joint, here we go. Pain. Patient, is there any pain?
No.
Patient, how are you doing up there? Pain?
A little.
A little means a lot, or a little means a
Just
little?
a little.
Okay, you're doing great. We're almost done. I don't like to. Okay. So that's when.
Oh, okay.
So, exactly. So, this is completely and totally normal. PRP, and I will continue to say it, PRP is not a walk in the park. PRP could be very uncomfortable. The patient right now, give me one second, let me just put something right here. The patient right now is feeling a dull, achy, deep, throbbing pain. And this will last about 5 to 7 minutes. After thousands of these PRP injections that I've done, that's the, in respect to time after, you can time it. Absolutely. But it works. And again, we were talking about, a lot of individuals. This is not only for, for feet, but for the lower extremities. In the hands of the right physician, PRP can be a phenomenal success with great outcomes. That's why, again, do your homework.
It's already feeling better.
It's already feeling better.
It's still a dull ache, but it's not as bad as it was originally. So, yeah.
There you have it. I implement PRP pretty much for everything. Even though it is not covered by the insurance, it's a phenomenal investment. For all of our MIFAS, our minimally invasive foot and ankle surgical procedures, we do the PRP. For, again, injuries, PRP. For toenail fungus, no PRP. It's a joke.
Okay.
But I'm sure people are looking for other alternatives for that as well. As always, I'm sorry for a little bit too much talking today, but I think it's important for people to really understand what is PRP indications. And in a case like this, this is really in the world of what we do, it's a pretty, we'll say, challenging case. Not because of the treatment, but because of the injury itself. As always, www.jospodiatry.com, Instagram, Dr. Tojam, Jos Podiatry, Facebook, and last but not least, our YouTube channel, Jos Healthcare. I want to remind everyone, for all of our viewers, subscribers that have not gone to our Facebook fan page, please do so. We upload a lot of information, a lot of other videos that we don't on our YouTube channel. So go ahead, Jos Podiatry, give us a like, foot and ankle specialists. You won't regret it, I promise you. Have a wonderful day, everyone.